let's talk about how to prepare for a delivery. So by now, you would have had a good talk with your obstetrician. You would be having some antenatal classes as well. So in these antenatal classes, what we essentially do is that we have a talk with our patients. We tell them about the forms of labor, we tell them about the signs and symptoms of labor, and we also tell you about the modes of delivery. We teach you how to do breathing exercises. We also teach you the right posture. We teach you some of the exercises like squats, etc. So it can be done by your obstetrician. Along with that, we have a wellness specialist as well and a lactation counselor who would teach you about lactation and some of the challenges which happen at the time of lactation as well. So these are the antenatal classes which you should actually enroll for, and most hospitals do have these antenatal classes. If not, have a candid chat with your obstetrician. By this time, also formulate a plan for delivery. So that's called a birth plan. So what is going to be the sign and symptom of labor? How exactly you would know when to reach the hospital? What are the modes of delivery? For instance, will it be a natural delivery which is unaided, or would you require some form of medication to aid the pains? Would you require an epidural analgesia? Or in case a cesarean delivery is to be done, discuss it all with your doctor. Have a birth plan in place, but remember, this should be a flexible birth plan because things can change during the course of labor. Also remember that this is the time to eat right. Small portion size, lots of nutrient dense material. For instance, have lots of green vegetables, have your fruits, have your salads, have proteins. Make sure that you're hydrated well. Apart from this, sleep well, at least 8 hours in the night, and if possible 2 hours in the afternoon as well. Make sure that you're doing some form of yoga, some meditation. Keep yourself very calm, and for that some pranayam, exercises, etc. are important. Keep exercising unless your doctor has asked you not to. So this should be done 5 to 6 times in a week, and make sure that you're doing it at least for 30 minutes. But do remember to listen to your body. If you're term and you're finding it increasingly difficult to exercise now, there is no need to push yourself. Exercise helps to keep those muscles toned, it helps to keep the feel-good endorphins coming, and it also keeps you very calm and happy. Remember to be positive all the time. You do not have to listen to all the horrible tales that some people may tell you about difficult deliveries. Remember also that your moms had their deliveries a long time ago. So things have changed a lot. Keep as positive as possible, and the only people you should be listening to are your partner. Listen to yourself. Along with that, also talk to your obstetrician or to your wellness specialist. A lot of people also want a doula during delivery who would give emotional support. So that also is available in most of the hospitals these days. A positive outlook, I do believe, is very, very important. Keep your labor bag packed as well, because post 37 weeks, you may require to head to hospital at any point of time. So most hospitals do have a checklist about what all you require, and these are as minute as what you need to carry for yourself, for your baby, as well as for your partner, including things like chargers for your phones, etc. So make sure that your hospital bag is absolutely packed. And last but not the least, as I said before, keep a very positive outlook. Make sure that you have help at home also, and that your logistics at home are well in place. Because you would want, for instance, to have someone take care of your older child while you're delivering in the hospital. You should have your groceries in place also once you get back to hospital, and make sure, even if you have a pet, there's someone to walk your pet. So there are little things like that which also need to be addressed. So stay positive, stay happy, have a happy and healthy delivery.